That's always a good start, and thanks to my esteemed colleagues and friends and Leanne, you are a tough act to follow. So I'm going to start a bit with some research and then do some personal stuff. My research is primarily concerned with HIV prevention for gay and bisexual men. As the Vice-Chancellor just mentioned, I lead national surveys which ask participants about their sexual practices, relationships, use of health services, drug use, the things they do to keep themselves and their partners safe, and the risks they experience. I'm indebted to the thousands of gay and bisexual men, including people living with HIV, who willingly divulge explicit details about their lives every year, and the hundreds of peers and colleagues who make the research happen, and I'm really pleased to see so many of you here today. I feel a keen responsibility to make this colossal ongoing collaborative effort count and to use the research we do to make HIV prevention as easy, accessible, pleasurable and effective as it can be for those who need it. And these are just some examples of research in the field. You don't have to do my research with your shirt off, but it does help. So, in the last 10 years, I've been particularly focused on understanding the ways in which new methods of HIV testing and prevention are developed and implemented, who is interested in using them and why, and the impact of these technologies on social and sexual cultures. A key focus has been advocating for and guiding the implementation of PrEP, and I wouldn't pretend that I was personally responsible for that. I've worked with so many people in this area. Now, PrEP, pre-exposure prophylaxis, is the regular use of antiretroviral drugs to prevent HIV. It's relatively new, but it's a highly effective prevention strategy, and my research has shown that there is a group of gay and bisexual men in particular who want and need it, particularly those who have difficulty using condoms. Now, PrEP is being rolled out across the country right now for people at high risk of HIV, presenting an opportunity to seriously curtail the HIV epidemic here, particularly if we can sustain high levels of testing, treatment, and other forms of safe sex. However, as anyone who works in education, research, or policy knows, bold new interventions rarely have straightforward effects, and sustaining successful behaviour change over time is difficult. PrEP at the moment is radically rearranging what we think of as safe sex for many gay men, as is the understanding that HIV treatment successfully prevents onward transmission, and this is a big departure from the way we've thought about safe sex in the past. These changes in knowledge and practice mean that established norms of sexual negotiation are currently in flux. This is an exciting, high-stakes period in HIV prevention, an experiment that could have global consequences. Now, I have the privilege of going on this journey in a field which has seen many successes and wicked challenges, and I used to describe this field in a different way as full of passion and long memories. And I have learned from an extraordinary set of people, researchers, community educators, activists, people living with HIV, people who use drugs, clinicians and policymakers, all of whom are committed to better health and an end to the HIV epidemic as we know it. These are just some of the organisations I work with. You can imagine the committee meetings. Other than research on gay and bisexual men's engagement in HIV prevention, I'm fortunate to work on a multitude of other projects with very talented people. These have various aims, such as evaluating alcohol and other drug services for LGBTI people, defining what an ideal HIV test would look like, understanding the harm reduction practices of gay men who use crystal meth, and evaluating the strengths and weaknesses of state and territory HIV strategies. What links this work for me is a desire to understand what matters to people who have sex, who use drugs, and who do and don't engage with services, recognising that the needs and priorities of community members are often poorly accommodated by top-down public health. This is important because in matters of sexuality and drug use, minorities are routinely blamed and made responsible for the health problems they experience, and this echoes Leanne's work. rather than dealing with inadequacies in policies, programs and services or a hostile legal or cultural environment. Let me give you an example from some research I recently published to emphasise what might be at stake. So earlier this year, my team published an article in the Lancet HIV journal on the uptake of PrEP by gay men in Melbourne and Sydney. The paper included data from over 16,000 survey participants who had casual sex. No one else internationally has such a comprehensive picture of the rapid rollout of PrEP and the broader effects on community sexual practices. It's a testament to the system that others set up before me. It should be noted that as PrEP rollout began, it was hoped that condom use could be sustained at a high level in order to get the maximum overall population benefit. The results we found were striking and a little complicated. The good news was that PrEP use had rapidly increased between 2016 and 2017 as large demonstration projects facilitated access in New South Wales and Victoria, and the PrEP uptake is in grey on the slide there. Those of you who know me will know that this is not my preferred colour scheme for this graph. However, at the same time that PrEP use increased, consistent condom use by other men, in green, fell a similar amount, and the proportion of men having condomless sex who are not using PrEP, that's in red and orange, stayed the same. Overall, there was more PrEP coverage, but also more condomless sex, and this had occurred in a relatively short period of time. And so we could see that prevention practices had entered a period of disruption. Now, the important thing to note is that HIV infections were falling in both jurisdictions for the first time in many years. So we surmised that the initial rollout of PrEP was having a positive net effect. But we didn't, and we still don't, know what would happen in the future, given that there was a large group of men who remained susceptible to HIV. The challenge to acknowledge both the positive and disruptive effects of PrEP on prevention then took on a more urgent register, as the Lancet Media Office decided to profile the paper in an international media release while Nigel and I were moving house. That was particularly good fun. It has to be said that I am always wary of doing media on gay men, sex and HIV, given the potential for salacious or harmful coverage. However, after the initial interviews with Radio National and Science magazine, I was pleased with what I thought was balanced, nuanced coverage and thought, mic drop, just get out of here and don't talk to anybody else. But things got dicey as other outlets weighed in and the coverage proliferated and spread across Europe and North and South America, and I haven't even been able to read some of the articles in languages other than English. The Guardian, who I normally regard as a trusted outlet, claimed that PrEP was making gay men complacent about HIV, and if you think about the language, you can see why that might be offensive. The New York Times, again, I thought a mic drop moment, I'm in the New York Times, linked PrEP with rising STIs, sexually transmitted infections other than HIV, and then other outlets raised the spectre of drug-resistant gonorrhea, always a favourite when talking about sexual health. An op-ed piece briefly appeared in Fairfax outlets claiming that the government here in Australia had been misguided to subsidise PrEP, and that was a process I had been involved in, arguing for that case. And the op-ed piece claimed because it would lead to more STIs. Along the way, the message that increasing numbers of gay men were protected from HIV, but that sustaining condom use might not be as easy as was first imagined, got muddied and blurred. Instead, outdated tropes about gay men as careless, reckless or irresponsible, or threats to the general population were deployed to get media coverage. This alarmed me and a number of my community partners, particularly my colleagues at AFAO, ACON and VAC, who were partners in the research and who wanted us to contest more outrageous and inaccurate coverage and to slow or stop additional media. They were concerned that the media coverage was hurting the communities we work with, stigmatising PrEP users and putting at risk opportunities to make HIV prevention more accessible, particularly in other countries in the region with less well-funded prevention responses. We wrote letters to the editor, we put out media correctives, and I had a brief Twitter fight with the AIDS Healthcare Foundation, who have been notoriously hostile to PrEP in the USA. That was a particularly fun couple of days. Then, mercifully, the media attention faded. What may yet be one of my career-defining publications had also given me sleepless nights and a strong sense of disquiet that my research could do harm and be misused to make prevention harder. So having had a few months to digest that experience and been reassured that everybody still loves me, I was recently reminded of a conceptual paper I wrote over 5 years ago about behavioural surveillance of gay men, and this is kind of just signalling that I did train as a social scientist once upon a time. Now I run all these massive surveys. This conceptual piece was about the bread and butter work I do at UNSW and across the country with my colleagues. In the paper, I considered the official top-down relationship between the evidence produced in surveys of gay men and the ways that evidence is supposed to affect HIV prevention and subsequently their behaviour, so the official relationship. But I also suggested that surveillance may have inadvertent effects, producing information, images and stories of gay men that can affect how they see and conduct themselves. Telling gay men, or any group, about their behaviour can change their behaviour in unpredictable ways, making them more difficult to follow, understand or engage. In effect, I argued there is no hard separation between the work of surveillance, the subjects of that research, and the practices we study. They are linked together by what the philosopher Ian Hacking calls a looping effect. My recent experience with the media was a more dramatic example of how survey findings may be communicated to gay men in unanticipated and uncontrolled ways. And I don't know how it may have impacted them. If social media coverage is any indicator, there was some concern, but perhaps a lack of surprise among gay men and PrEP users about how they were being portrayed. But this recent experience has really underscored to me the responsibility I have to do research with care in ways that help and not harm my community. And to do that, I rely on relationships with my colleagues, my peers, my friends, and my family. Okay, so let's see if we can get through the personal bit without crying. But anyway, all bets are off. So part of the brief of this lecture series, obviously, is to explain where we come from, who helped us and inspired us. There are some very important people who have already been mentioned who couldn't be here today because they live in the UK, including my parents, Elaine and Steve, enjoying a drink in Woolloomooloo in that photo, my brother Clive and sister-in-law Gemma, and a whole heap of friends from near and far, some of whom are shown here at the bottom. My husband Nigel is here today hiding near the back. And we recently celebrated our 20th anniversary, so check out that photo, that's from 20 years ago. Check out, I believe I am wearing a boa. Nigel has seen all the joy and horror brought by an academic career, including, I believe, having to pay my rent at some point while I was trying to finish my PhD in Birmingham, and I believe I have paid that back. But without all of these people and many others who I haven't mentioned, without their love, support and quiet, unyielding encouragement that I could go as far as I wanted to, there you go, I would not be standing here today. And I've often said that my parents in particular, particularly my mother, just always instilled this sense that I should never stop until I got further. She was a little bit pissed off I didn't go to private school, but anyway. Products of a public education. Academically, I have been fortunate to be inspired and encouraged by some extraordinary people. Cathy Campbell, a social psychologist, taught me at LSE and supervised my master's thesis on gay men's representations of health. She has devoted her career to doing community-based research on HIV in South Africa, so you can see where I get some of the inspiration from. And she made Foucault intelligible to me, and for those of you who know Foucault, you'll know that that's quite some achievement. My PhD supervisor, really, I owe an enormous debt to. Chris Griffin, was a feminist youth researcher who trained at the legendary Birmingham Centre for Contemporary Cultural Studies, and then made a career in critical social psychology. She gave me free rein to draw on any discipline I thought was useful to research young people's sexuality and the use of commercial leisure spaces, the topic of my PhD. That has given me an ongoing freedom to roam disciplines and be suspicious of any academic who is too rigid in their thinking or approach, and to know that all research findings are made, not found, and rely on interpretation, and we should never hide from that. Now, it's difficult to know how to acknowledge the impact of a living legend like Sue Kippax. See if I can embarrass her more than I'm embarrassed. I was fortunate to work at what was then called the National Centre in HIV Social Research, one of 4 federally funded HIV research centres, when she was the director. A fearless leader and advocate for the social sciences, she encouraged us to do the best we could possibly do, to question and to hold biomedicine and public health to account, to engage with theory and make it useful, and to understand practices from the perspective of those who engage in them. She continues to inspire me, and we continue to argue about the risks and benefits of biomedical prevention. Long may those conversations continue. John DeWitt was the director of the centre after Sue, and he pushed me into managing the gay community periodic surveys, which is the way I know many of you here, when I really wasn't sure I was up to it. I really had to dust off some stats skills pretty fast when I got into that job, and Evelyn Lee, if you're in here, you are responsible for keeping me going in that first 6 months. That decision gave me a voice on the national stage, the decision that John made. Gave me a voice on the national stage and leadership experience, and the independence to build my own research program, all of which led to me being here today. Now, Carla Treloar is kind of gallivanting at some overseas conference at the moment. She's our current director, but she actually gave me my first proper job at the National Centre, together with a crash course in harm reduction research and how to work with peer-led community organisations. I was so green. I knew nothing about harm reduction and drug use and mental health at that point. It was an amazing experience. She is currently leading the centre through an exciting phase of growth, attracting amazing new scholars to come and work with us. And she also held my hand through the more terrifying parts of applying for promotion. She even celebrated with me on a Friday afternoon when I found out I'd got promoted and there was almost no one in the office. Thank you, flexible work practices at a research centre. We did manage a bottle of champagne between us. Anyway, I also want to acknowledge some particular colleagues and friends, and then a long list, who were instrumental in getting me an opportunity to work at the centre, made me and Nigel feel welcome when we were new to Sydney, and continued to inspire me with their friendship, humour and amazing work. I met Neve Stevenson during my postdoc at Western Sydney during 2001 to 2003, and if it's normalising for everyone, I pretty much hated my postdoc, but anyway, there we go, I've gone on to better things. And in that terrifying period afterwards, when I didn't have a job, she found me work, and she introduced me to Dean Murphy, who was currently working at the centre. He employed me as a casual research assistant, and with his support I hung around long enough until a contract became available. I believe this is a well-known postdoc strategy. Hang around for long enough and be annoying until someone gives you a job. Dean also introduced me to the Australian Federation of AIDS Organisations, and I worked on one of the joint conferences we used to hold, which was honestly something to behold. I met nearly everyone in the field at that time through that work, that casual work, relationships that have remained vital to me today. Nigel pointed out to me that he had never seen me so happy at work before, which I think was to do with the culture of the centre and the HIV field, and not my precarious employment status. I then got to work with amazing people like Jeannie, Patrick, Robert and Christy, who are shown here, all of whom I still count as friends today. And there are many others who I've worked with for years, and some newer faces who make coming to the office a pleasure. Limin Mao, Asha Person, Jake Rance, Kylie Valentine, Evelyn Lee, Peter Hull, Peter Aggleton, Joanne Bryant, Lauren Breda, this is quite a long list, Max Hopwood, Karen Drysdale, Alex Broom, Kari Lancaster, Tim Brodie, Steve Bell, Toby Lee, plus all the amazing people in research support, Annie, David, Hannah, Lisa, Joe, Darren. Thanks to all of you. That was the bit I choked up on when I practiced that. So done quite well getting through there. Note to all people starting out in research careers, always make friends with research support. You will go far. And then there is literally a cast of hundreds of others to thank. Everybody else at CSRH and SPRC, our sister centre now in the faculty, the Kirby Institute, Arches, the Burnett Institute, the Faculty of Arts and Social Sciences, particularly Helen Groff, who has been a real inspiration to me as Associate Dean Research, Sue Dodds, our Dean, everybody else at UNSW, and all the people I get to work with at other universities in Australia and overseas. Special mention goes to Garrett Prestige, Rebecca Guy, Andrew Grulich and Mark Stuve from the Kirby and Burnett Institutes, who have been generous collaborators and friends. The health departments who fund so much of my work always remember to thank the funder. Researchers, professional staff, community partners, policymakers, clinicians, activists, students, there are literally too many of you to thank. I started to compile a list of people who have inspired my work, been generous with their time and expertise, educated me, and simply made shit happen. It was too long to do justice to, and I certainly couldn't have fit it on one slide. My